a multi-level building. So the,
Oh,
the
okay, got it.
multi-level theme. Yeah.
I like to think about multi-level cakes, but I will now add the buildings. But this paper basically came about because, and this was a debate paper, so we assert some opinions and some arguments in this paper. And the big one is basically that all implementation research is multi-level until proven otherwise. So you got to start with the assumption that you're going to have to deal with multi-level context in some way. And yet the field isn't necessarily equipped to deal with that all the time. Not everyone can do in-depth multi-level training or really wrap their arms around decades and multidisciplinary sources of literature. Not everyone can hire a multi-level specialist on their research team. And although in the paper, talking about the paper, we have kind of grand visions for the field in terms of beefing up multi-level training and implementation research, I'm impatient and I don't want to wait that long. And I wanted to think of what is a bite-sized, actionable chunk of this huge topic that we could offer the field and act upon now. And so that was really my motivation for assembling this team and going through the process of writing this paper, which was truly the hardest paper I've ever written in my life, because it really is so massive, and you could spend years learning about it. So even though we spent tons of time synthesizing and condensing and organizing the material in the paper, it's still a lot. And so a huge part of today is just giving you a taste of it, giving you a sample of the types of resources we included and our approach to selecting and explaining these eight characteristics. And you're not going to walk away being ready to handle every issue or knowing every term or concept that we present, but we hope that it just gets you a little bit excited and makes you feel like you have this really good resource and foundation for learning more. So I like to kind of set expectations with this paper because, again, I really respect the mountain of research and tons of existing researchers who have been doing this for so long. And so I definitely don't think that we are creating something new. I see Erica there, and she's another one who really bridges these connections with existing disciplines and works on translating things that are common in other fields to implementation science. And that's what a lot of this paper is. And so again, this is a single paper. Nate and I have tossed around the idea of like writing a book someday, but we only had the limitations of a manuscript. So a lot of it is raising awareness about the types of things we need to think of. We've really spent a lot of time picking these 8 characteristics. So we decided as a team that those are core building blocks to get you started. One thing that was really important to me in conceptualizing this paper was including a qualitative perspective, because a lot of existing resources on multi-level designs and analysis have a real quantitative bent. And then again, we wanted to do the heavy lifting of not only saying here's a bunch of resources, but actually giving you implementation science specific examples in language, so that the material we are bringing over from existing fields is easier to grasp and jump into the implementation research issues that we face. So we're definitely not going to get into every possible multi-level implementation research issue you will encounter. We're not going to go super in depth with any technical guidance for either quantitative or qualitative methods. Our plan as a group is to do some side papers with that someday. And we definitely can't tell you, what you should for sure focus on in your project in terms of levels or constructs or an analysis plan. And I found this quote when I was looking at other kind of best practice articles in organizational science, and we basically are lifting what Melina and Azarin and colleagues did. And so with this paper and this presentation today, our approach will really be to see the forest rather than the particular trees. So we're going to examine the big picture, indicating the main elements of multi-level research. An exhaustive analysis is way beyond the purpose of this paper and this presentation, but we will give you key references, examples, and kind of starting points that you can use when you're bringing multi-level research practice into the implementation topics that we're all interested in. So here's a list of the 8 recommendations that we came up with. And we spent a lot of time on every little aspect of this because we were like, should we make a checklist? Should we make guidelines? And we ended up saying characteristics, so features of studies. Rigorous multi-level studies have these 8 features, and that was pretty intentional language. So for the rest of the presentation, Greg and I are going to go through each of these. So I will do the first 4, and then Greg will wrap us up with the characteristics 5 through 8. And this was the full team that put this paper and did all the thinking and helped me pick which ones we should focus on and how should we explain them to implementation science audience, and what kind of practice examples from actually doing implementation research ourselves, multi-level implementation research, can we integrate into not only the actual content of the paper, but how we explain it to people. So this is our team, and shout out to Nate. He is my co-first author on this, and we were a lot of psychological support for each other as we almost gave up on this paper multiple times. But I just want to highlight that this is 7 brain on this paper, and again, it's such a huge topic that I think each of us have our own pages. So I love presenting this with someone else, and again, excited to do it with Greg. So in the paper, we tried to make it as easy to get through as possible. So for each characteristic, you'll have a brief rationale and you'll have some concrete action steps. Along with each characteristic, we put together an additional file, and this is where the bold and like the practical language and tips are. And so I really, whenever I mention this paper to someone, I often ignore additional files, but this is one that I think the additional files are as important, if not more important, than the actual text. And so we spent a lot of time thinking about, we don't want to just say here's 5 resources or articles, but how can we make this usable? So we have some checklists, examples that are really specific to implementation research, some practical considerations, which again came about from this authorship team's experience. And then Nate and I put together a glossary of terms because, again, I think a barrier to really digging into the multi-level literature is there's some language and terms that are commonplace there that sound really jargony and kind of abstract. So we did that. We made a summary table with our characteristics and kind of broke down the action steps for each so that you can use that either when you're planning a project or when you're evaluating a grant or a manuscript. And then one of my favorite things about this paper is, I think a hard thing about these kind of recommendation papers is like putting all the pieces together in a single project. And so this is where we really built upon the Aspire trial led by Renard and Nate. And so we have additional file 9 that applies all the 8 characteristics in this actual implementation trial that's going on right now. So you can see all of them in one place. So our first characteristic is and again, the STEM for this is rigorous multi-level implementation research, in that we map and operationalize the specific multi-level context for defined populations and settings. Okay, so what does this mean in plain language? What we're asking you to do here is comprehensively think about what layers of context are important for your implementation research question and what they look like in your study. So I was just working on a grant with an emergency room doc at WashU, and she done all this work understanding individual behavior around de-implementing low-value practices. And she's like, I know there's stuff going on in the context, but I don't really know how to organize it or how to think about it. And through a series of conversations, we decided that these 3 levels that are important in her study are that individual level, the unit level, which in her case is the emergency department and the ICU, and then the 3rd level is the hospital level. So there's nesting there, which we'll get into a little bit later. But this is what we're talking about, is just really practically breaking down your context into these levels so that you can then do the rest of our steps. So it's really important to do this because, again, rather than blurring context or environment altogether, doing this actually helps you prevent blind spots in your analysis and your interpretation of results, and sets you up to collect data that will really give you a more full picture of what's going on. And so this is kind of what we do in the paper, like here's this like broad kind of meaty thing to do, but where do you start? So with this characteristic one, we suggest that you visually map out the contextual levels you're thinking about. I love doing that just on a piece of paper or like in some kind of table. So I'm working with partners in New York right now. And I made this table when I was starting to think, okay, what levels of the context are important? And I used, first, I work with Greg, I have to use the EPIS framework. So I use that to organize this a little bit. And as I was doing so, I isolated these levels that were important to this particular project. So in the inner setting context, we have individual clinicians and agency leaders. And those are both nested within the agency level. And then there are all of these agencies throughout the state that are nested within New York. So the bottom, I have individual clinicians and leaders. Second level is agency level, and then all of that is kind of encompassed within New York State. So it doesn't have to be this detailed, and again, you can literally just draw some horizontal lines on the paper and start labeling them, but really breaking down what levels are you going to kind of wrap your arms around in your particular project sets you up to do everything else that we're doing, and spending the time with that emergency room doc. Spending the time really thinking like, do we need to include the hospital level? Why? Kind of what are the different things going on at the level, and kind of justifying and proving their worth, I think is worth doing too, because every level that you add adds a lot of complexity and work. So you do want to be parsimonious about that. So we don't have time today, so I'm just going to give you these little teasers of additional files, and I'm not going to give you any more than that, and I'm sorry, but here's a teaser for the first characteristic, and this is a list of prompts that we came up with and just trying to create that map of contextual levels. So after you've mapped your levels, you're then going to define and state the level of each construct. So in plain language, figure out what your levels are, which you just did. Then you're going to figure out what constructs you want to consider, and then which levels each construct is in. This is important because it provides the basis for the accurate construction of measures, the treatment of analytic variables, and the appropriate interpretation of results, which Greg will be getting into. So again, where do you start it? Where do you start with this kind of conceptual thing we're asking you to do? So first, define the construct, identify the level, and then provide an explanation or mini theory for the level. And with this number 3, especially when I'm working with people who are not researchers, I just say, tell me what you're seeing. Just say it in plain language, and then I can do the like theoretical translation later. So I'll show you what I mean here with organizational culture. So our first recommendation is define it. So a common source for defining organizational culture is Outshine. This is his often cited definition. I won't read through it, but it's there. The next step that we suggest that you do in a project is saying, okay, where is the organizational level construct in my particular study? And so for this example, I'm saying organizational culture is at the hospital level. And then this is what I mean by providing a mini explanation or a theory that clarifies why you think organizational culture is a characteristic of the hospital. So in plain language, again, drawing upon that existing definition from Shine, medical providers work together. They observe each other, they learn from each other, they see how people react to their own behavior and the behavior of each other. They notice what policies, goals, and organizational processes are formalized and enforced. And through all these social interactions, medical providers develop a shared understanding of what the norms and values of working at the hospital are. Culture at the hospital level then emerges from these individual provider level experiences and behaviors. And I won't spend too much time on this now, but I think a lot of times in implementation science, we throw in climate, we throw in culture, we throw in leadership, but we don't really do this part of like, does that actually make sense for our particular project? And if so, how would that actually work? So quick teaser, if you want to make one of these levels where or tables where you're saying, okay, here's the level, here's the construct, here's the theoretical rationale, we have that all for you with the Aspire Child example. Okay, characteristic 3. You have your levels. You have the constructs and good reasons for why they're in each level. And this is my favorite part. It's really getting into what are these relationships across the levels? How are the levels influencing each other? So in plain language, we are asking in this characteristic that you identify and describe top-down and bottom-up processes that explain how the levels in your study are connected to and influence each other. So in our paper, we have this visual, because top-down and bottom-up is one of those examples of language that is familiar in multi-level, but can sound weird if you're not familiar with it. So what we mean by top-down processes is where it is exemplified here. So we have the organizational level. Implementation climate is a construct that resides at the organizational level. And that arrow going down shows how implementation climate influences the provider level construct of competence to implement with fidelity. And since we have 3 levels here, we have another top-down process where that provider level competence to implement with fidelity then affects the patient level experience of fidelity to the intervention. And you can identify all kinds of top-down processes in your own work. And again, it's anchored in whatever levels you've identified. And I always like to do a bottom-up example with the same construct. So let's stick with implementation climate. So here we have individual level, we have clinicians. So clinicians are observing each other's behavior around EVP use. So things like, can I adapt? Is fidelity monitored? Do I get in trouble if I don't go to training? And then supervisors are responding to their clinicians and, have certain expectations. They're paying attention to certain things. They're either explicitly or implicitly rewarding or punishing things. And collectively, that behavior and those social interactions create this property of the organization, this implementation climate, or the degree to which there's shared understanding among individuals around what the organization values, recognizes, and supports in terms of EVP and its implementation. So that's what we mean by bottom up, when a lower level is affecting a higher level. And I won't get into it too much, but there's a lot about this idea of emergence when it comes to bottom up processes. So this is an essential step for planning your data collection and analysis. Again, I think a lot of times people get through that first step of, here are my levels, I'm gonna do climate here, and some sort of like psychological safety at the team level, and, attitudes at the individual level, but don't really like outline why those things relate to each other, or if it actually makes sense in your particular situation. And I added this second line of why it's important. So going back to my colleague in the med school, I encouraged her to do this, and she mapped out the levels at the individual emergency department and hospital level, the constructs at each, and then she's had a million different colored arrows of all, organizational affecting unit affecting individual, and individual affecting unit. And I was like, this is so cool. Each one of these lines is a testable relationship. This could be like 20 years of research because you took the time to actually identify these relationships. So again, where can you start? And as you can probably tell by now, I'm a really visual person. So I suggest mapping it, drawing it out like this. And I really learned from Greg how to do this with the 3 levels, and he'll show you his loci example. But write your levels, write the constructs, and draw the arrows and what those arrows actually mean. And this is something where Mark on our team made me a little bit less snobby. I was trained that you should really draw upon kind of existing organizational theory. And he's like, and I've come around a lot with implementation research too. You can have your own kind of practice-based, and this is what we mean by meaning theorizing. So maybe it's not actually rooted in existing theory, but you are talking with your partners and your team about exactly why implementation climate, this bottom arrow affects patient level experience. So theory can be, when we use the word theory here, it can be interpreted pretty broadly and informally. So again, quick teaser for our resources in this paper. Again, we have a glossary. So as you're reading this characteristic, you're like, oh, what does that bottom-up processing mean? You can just go here and get a pretty, hopefully succinct definition. Okay, so my last characteristic is, and I, I was gonna say this is one of my favorites too, but I think they're all my favorites. But, and this is one I think people don't think about a lot either. And here we are asking you to really specify the temporal scope of each phenomenon at each relevant level. So in plain language, for each level in your study. So again, in the tape or in the figure I just showed you, there was patient, provider, and organization. Ask yourself, how quickly can I expect to see change at the organization, provider, and patient level, for example? How long do I need to wait before I first measure change? How often do I need to measure things to pick up on those changes? So I was on a project with colleagues in Sweden, and they were measuring fidelity at the provider level and the site level. And originally they just had 3, 6, 9, 12 months time points for all of the levels and all of the variables. And they were asking me, like, when should we measure fidelity at the site level? What are the rules? And I was like, there's no standard, you should always measure 6 months after doing something. A lot of it comes down to what you're asking of people to do and what you know about your site in terms of when it's reasonable to expect change. And I think sometimes we get locked into these measurement choices in terms of when we're going to measure things, and it can distort whether or not something is working or not, because sometimes, especially at higher levels, we need to give things a little more time to actually see change. So another question you can ask yourself to get at this temporal scope is, how is change at this level going to match up with change at another level? And if I'm seeing change quicker at the individual level, for example, how am I going to make sure that I'm kind of slowing down the measurement at a higher level so that I'm capturing all these different timelines? And then along with temporal scope and measurement, kind of thinking about what's going on at different levels, you can consider, is there something expected, like a planned major leadership change? We know our deputy director is going to leave, or maybe there's something unexpected, like the global pandemic going on, that could affect kind of the timing and pace of change at each level. So this is important because people, teams, organizations, and systems change at different rates. And a rule of thumb in organizational behavioral literature is that lower levels are going to change quicker. And I added that organizational behavioral literature point because when I presented this at WashU, Ross Johnson was like, I don't agree. I think, it can actually be faster at the higher level when we're thinking about policy change. So rules of thumbs will depend on which discipline you're in. And the bigger point is just kind of acknowledging and accounting for the fact that the rate of change is not consistent at every level. So where can you start? This is where I will point you to additional file 4, where we created a list of prompts to consider when you're deciding and explaining the frequency and timing of measurement at different levels. So here it is, we can look at it later, but the first one, for example, when you expect to observe change in each relevant outcome at each relevant level. So yeah, don't have time to go too much. So I'm handing it off to Greg. I know this is a really kind of meaty, potentially dense and boring presentation, so I just wanted to break it up with my extremely cute niece, McKenna, and I'll pass it to you.
Yeah, I can't compete with the cuteness, that's for sure. So thanks, Rebecca, for the little happiness break there. So yeah, so moving forward, characteristic number 5, and I've seen some questions and comments in the chat, and I'll say we'll have time to talk about some of those. So number 5 is to align measurement choices and construction of analytic variables with the levels of theories selected and your hypotheses, if applicable. So this is really, formative in terms of, how you're conceptualizing things from the get-go. And so what do we mean we just want to be sure that the measures that we're using and the way they're collected and adapted are consistent with the levels and theories of interest. So, the measurement has to align with the level of theory. And this is really important because often, like, people will just use measures off the shelf without thinking about, for example, the referent. So how the questions are asked impact how respondents and participants respond, and the validity of those responses for making inferences at the level that you're interested in. So it's really hard to disentangle these measurement issues from findings after the fact. So, you can start for each construct, review those items and questions and thinking about the referent. So, for example, if you want to know about leadership at a clinic level, but you ask about leadership in the organization in general, you may not get the information that you want. You may be getting information about a broader, higher level context within an organization rather than the clinic unit that you're interested in. And you want to be sure that participants can report on the construct. So I've seen measures where someone's asking a clinician about leadership at the system level, and they may have no exposure to the person that they're being asked about. So you just want to be sure that those participants can report on their leader if it's leadership. And then also you want to be sure that you can aggregate the individual level data to the unit level when appropriate, and that you have good evidence for that. So, as you think about these types of unit level constructs, I mean, there's three that we called out in the paper: these global constructs, shared constructs, which we're going to focus on, but also this idea of configural constructs, which is like another level that takes into account more of the complexity in a setting. So the global constructs, these are ones that originate at unit level, and they represent objective, easily observable characteristics of the unit. So in these, you don't have to rely on individuals' perceptions, experiences, or attitudes or behaviors to measure those constructs. They're a property of the unit as a whole, and again, they're more objective. And there isn't really within unit variation. So if you ask multiple people within a unit about a global construct, you should get the same answer. Now, I will give a caveat that sometimes there is variability in how things are provided. So here's just some examples: number of employees, number of clients served in a program, number of subunits in an organization, annual revenue. And we have had instances where we got this information from a higher level in an organization. When you drill down to subunits, there may be some variability, but you should be able to get at those objective answers. They don't depend on people's perceptions and attitudes. Whereas shared constructs are more those perceptions at the individual level and are shared across the unit. So you do rely on individuals' perceptions, experience, attitudes, behaviors to the measure, or what's and how their perceptions are shared or not. And the shared constructs describe characteristics that are common to or shared by the members of a unit. So in that case, you have to take into account the degree to which those individuals giving you data actually agree with each other. So there may be an assumption if you're assessing, implementation climate, for example. Is there variability in the answers you're getting? The perception of climate should be shared, but there may be differences in that. So, culture, climate, organizational citizenship, psychological safety climate, those things are examples of shared constructs. So, when you look at things like implementation climate, there are kind of a number of different dimensions in the implementation climate scale that we developed. Brian Weiner and Sarah Jacobs and colleagues developed another implementation climate measure But bottom line is that, the idea is that these are shared constructs, but the level of, or the amount of sharedness can vary. So if we look at individual scores, in a group that work together in a unit, what do we notice? Are the scores hanging together? So here, if we're using, a 1 to 4 scale, you can see here that perceptions are generally positive, and similar across. So there's a lack of variation. So the inference is that there's a shared experience going on in this group. And as we'll talk about, this is important not just for understanding the phenomena, but for how you measure it and whether you aggregate or are justified in aggregating to the unit level. So in general, this is a picture of people experience a positive implementation climate, average 3.7 across this group. So what do we notice in this group? Same measure, similarity across the measures, but lower scores. So yes, they hang together. They're on the negative end. And again, because of the lack of very significant variation, we can infer that there's shared experience. So generally, these individuals are experiencing a more negative implementation climate or lack of a positive implementation climate, average 1.3. So in this example, you see we have multiple individuals again, but are the scores hanging together? No, they're not, because you see variability. So if we, look here, we have a score of 4 on a climate measure. Here, a score of 1 on the climate measure, 3.6, 1.3. So a lot of variability. So we can't infer that there is, in fact, a shared experience going on here. These individuals are just all over the place around their perception of climate. And so, there's an average, but, it doesn't tell you anything about the sharedness if you just look at the average. So it's really important to drill down on these and understand that. So, when people agree, in this case, that the climate is not positive, or they're all over the place, that tells us different things, very different problems and potential implementation strategies, solutions. One might be to, if it's a negative climate, then you might focus on really raising the level of climate. For this group, you might focus on bringing together those perceptions of climate and having techniques or ways to really have more common perception of the climate. And then you can think about raising the climate. So, again, the message here is to avoid misalignment as much as possible. So, again, it can also go back to how you design your measures and if you're not asking the questions in the right way. So you want to, for example, avoid using individually referenced items to measure a theoretically shared construct. So, rather than I am expected to do this, it's clinicians or I and my coworkers are expected to do this in the organization. So those reference become really important, not just conceptually, but for the measurement as well as you go forward. So it's important not to treat these shared constructs like global constructs as you go forward. So the question is whether the individuals can even speak to a shared property of an organization team. Do they work together? Are they actually around each other or communicating? Because I've seen teams that are remote teams that actually have high commonality in their shared perceptions, and some that work together in the same building, they may not necessarily have those same shared perceptions. So it's really important for us to sort of eke out and understand those different issues, and think about whether there are other ways of grouping people that are more meaningful in a given setting. So again, it's identifying that best target for our implementation strategies in order to address the problem at the levels that are important, and depending on the multiple levels in an organization. Okay, spent a long time on that one. So characteristic 6 is using a sampling strategy consistent with the selected theories or research objectives and a large enough sample and variables to examine the relationships at those levels. So what do we mean? So need to make sure that the sample is an adequate size at the levels of interest, and pay attention to issues of variability and representativeness at each level. And this is from a quantitative perspective. It's important because implementation research often considers interventions and outcomes that cut across levels. So your sampling strategies can have negative effects for your findings if you're not sampling appropriately across those levels. So you can start by building on other characteristics and ensure that the sampling choices align with constructs and relationships being studied, as well as measurement choices. And additional file 6 gives prompts to consider when designing your multi-level study and checklist for a sampling plan. So in this NIDA study, I was PI on, we were intervening at the org level and at the leader level. So this higher level at the leader level, and you can see this is multi-level from organization leadership and group level or clinical level leadership affecting group level implementation climate, which was hypothesized to affect attitudes toward evidence-based practice, implementation, citizenship behavior, and reach and fidelity. And so, we had to think about, the org level, the group level or clinic level, and also the individual level. And we were really most focused on the clinic level, and our randomization was within organizations, randomizing groups or clinics to our leadership intervention. And so, we powered this. And when I first heard this from my statistician, that you need 60 clinics randomized to one of two conditions, we followed that advice. And so we had the units that we needed to undertake the analyses. So for each of these three levels, we had to think, is my sample big enough? And is there enough variability? And is it representative enough so that we could apply the quantitative approach? And what can we learn and contextualize with our qualitative methods enough? So, so this is just another example of honing into these different levels and really thinking through what's needed at each of those levels. So the 7th recommendation is to align the analytic approaches with the chosen theories and hypotheses, ensuring they account for measurement dependencies and nested data structures. So we mean there's no single best way to analyze data from a multi-level implementation approach. Anchor point, ask yourself, does my analytic approach fit all of the things that I figured out, understand, and set up in those previous characteristics that we've gone through? So a lack of alignment between those theories and the hypotheses and how data are analyzed can lead to erroneous conclusions, but also importantly, if those aren't aligned when you submit your proposals for review, statisticians and methodologists are going to look at the relationship between the theories and hypotheses you proposed and whether or not you're actually assessing those at the appropriate level. So you can start by being very clear on the levels of theory, constructs, and measurement. Right? The more clarity you have and have clearly specified those levels, and your measurement addresses those levels, and like the reference for your measures refer to the correct levels, then it's going to make analyses more straightforward. And then select analyses that account for dependencies in hierarchically sampled observations. So if you have a 3-level model, you're going to have to be able to, assess those 3 levels with your, not only your nested data structure, but with your analytic techniques. But then it's really helpful, I think, to be clear in the write-up on what decisions were made and why. And I think for us as investigators, and it's like for me personally, it's important to do that write-up and then go back and review and say, is this clear? Am I specifying why those decisions were made? Do my, measurement tools refer to those theories, constructs, and hypotheses at the appropriate level? And is this a clear explanation as we go through? So it's really important to think about those measurement dependencies and nested data structures as you're doing this multi-level research in implementation science. So what do we mean by nested? So we can, have a study with patients, we can have providers or leaders, maybe all in a surgical oncology department. And so, we have these levels of nesting. We have a hospital unit, we have providers, so n equals 3 at this level, and then our patients nested within that. So the measurement dependencies are, is there the shared experience of Dr. A, Dr. B, and Dr. C's leadership, and what's it like to be on their team? So, our reference for this group would have Dr. A's name as the referent. So Dr. A provides strong leadership on this dimension, right? For this group, it would be specifying Dr. B. And, sometimes I've gotten pushback when we recommend this, how do you do this in a survey? But you can pipe in these responses based on, understanding the organizational structures from org charts and team rosters and things like that, so that you're, putting in the relevant referent in your measures, so you can really understand and minimize misspecification of these dependencies. And finally, characteristic 8 is to ensure inferences are made at the appropriate level. And so in plain language, we want to reach conclusions about our findings and address their implications for practice. And so we need to make sure implications reflect what we actually found. And so we want to infer effects at the correct level. If we do this at the wrong level, we can limit or misdirect the advancement of implementation science. So for example, if I say, leadership in this organization was associated with, fidelity in our implementation strategy, affected leadership, and that impacted fidelity. And if we talk about leadership broadly, someone may misconstrue that we're talking about executive leadership, when really what we're talking about is the leadership at the clinic level, where there may be some variability as well. So if we're going to, advance implementation science, create policies, we want those things to be at the correct level. So, we want to be as efficient as possible, and the specification becomes extremely important. So you can start by following the suggestions from the first 7 characteristics and really think through these issues. But then also in writing up your results, be very kind of specific about all of those issues, how your work is construed, at what levels it's construed, and then what our findings mean and how to interpret them given those levels, because often there's not enough of that done in the field. So, we just wanted to mention a couple of different fallacies related to this, the atomistic fallacy, that you have, really promising individual level data, and you think you can apply it to the team or org or some later other level, but financial incentives given to clinicians may have improved EBP use, and so you increase adoption at the agency level and give the agency money versus providing incentivization to clinicians, or providing financing grants to states versus provider organizations, when there's differences in how those applied. And our work of our colleague Alex Dopp up at RAND is looking at that with respect to implementation of and sustainment of evidence-based um, treatment for substance use in adolescents. And he's got some really interesting findings that dichotomize that, really look at the difference between these different financing structures. The ecological fallacy is that you have a cool and promising team org or some higher level data and think you can apply it to individuals. Again, an organization high in readiness, for example, having the resources and infrastructure in place to implement, that it may be related to feasibility at the org level. But individual clinicians indicate high individual level readiness. This must mean that EBP implementation is totally feasible for them too. It's not necessarily the case because there may be other factors such as workloads and competing demands that may impact implementation activity. So, I think low-hanging fruit for the field is to be precise in our language and descriptions, and to really be clear about those relate to how we frame these multi-level issues when we're thinking about implementation strategies and approaches. So, Rebecca, you want to take the takeaway points, or?
Sure. I think you have to advance it for me though. And I'm so sorry we didn't leave a lot of room for questions. This presentation is so hard to do in a decent amount of time, but key takeaway points from this presentation and hopefully the paper that you will now be excited to read. Multi-level implementation research is deceptively hard. And again, we don't want to assume that everyone can get a multi-level expert on their team or everyone should go take a class or something, but just respecting how hard it is and kind of taking that into account a bit more is something that we hope the field can do. You can't measure and deal with everything. So I think a theme across these characteristics is being really intentional and thoughtful about why you picked your levels, constructs, and certain relationships to focus on. And along those lines, we can do better as a collective. We actually specify and report this reasoning more when we're conducting multi-level research. And again, kind of our big vision is that this is a really important area for growth in the field in terms of how we're trained, who's on our research teams, and what existing literature and thinking we can bring over and leverage more in implementation science. So yeah, Greg, we didn't give hardly any time, but the paper is there, and here's our emails. If any of these things we might have time for like a couple quick clarifying questions, but please email us, and if you have that paper and the resources now, we're happy to answer questions. And that's the evaluation. Thank you, Monica. It looks like we have a few minutes if anyone has any kind of questions or comments.
Hopefully we didn't just scare everyone away from doing multi-level.
That's when we put the baby pictures and like the calming grass and the flowers.
I have a quick question, maybe. This was awesome. Thank you both for sharing this super cool paper and breaking it down. It's fun to read it and then also see it get presented. It just sort of works in my brain in a different way. So thank you for that. My question was about one of the later recommendations about temporal considerations. And I always wonder this when I think about like policy D&I happening. Like when I think about policy actors, I think about also maybe provider organizations and payers. And then I start asking myself, well, how am I defining my EPIS phases? The implementation strategies are being paced, and designed in these very specific EPIS phases. So thinking of like really defining what exploration, preparation, implementation, and sustainment are for one of those levels. And then sometimes I'm like, oh crap, now I think another level is at a different EPIS timeline.
Yeah, I agree, especially thinking about policy implementation. It's like once it moves from kind of, deciding to do a policy to actually enacting it, like then you're kind of starting over in a lot of ways or
Yeah.
earlier in time. And so, yeah, I think that kind of And again, it opens up such a huge can of worms and hurts your brain and makes you want to quit because it's so hard. But like that kind of nuance and critical thinking is exactly the type of kind of pausing and reflecting that we're hoping will come out of this paper. And I think you're one of the scholars that can actually like figure out the methods for doing that and some guidance around like how to juggle different timelines at different levels.
Yeah, I know in our experience, we've, it's almost like we are on different EPIS phases depending on what level you're in, but also, the emergent things that change. So for example, there's an election, the government changes, the, health authority people change, and how do we capture those changes? So sometimes, we'll jump in with additional measurement and assessment at different time points to try to capture those things. And yeah, and I think that's a challenge in some of the multi-level research as well, is how do we handle those changes that are inevitably going to happen in a prospective study? And we're happy to consult on those things through the DISC. We have a consultation service at the DISC, so we can pull in Rebecca to help
I
consult
was
on
just gonna
those
say,
things.
Greg can fix all your problems and tell you what to do.
Yeah. Any other questions or thoughts?
And again, it's a lot, so feel free to email
Yeah.
us if something comes up later. We're happy to keep discussing.
Yeah, thanks everyone. Do you want to close this out, Kira?